Disc herniation surgery might sound frightening, but to many people the surgery itself isn't even the hardest part. Recovery is. And understanding what's actually happening inside your spine can be the key to understanding everything. Think of the discs in your spines as small cushions or shock absorbers between the bones, the vertebrae. Each disc has a soft gel-like center and a hard outside exterior. Think of it as a tire holding in jelly. A bulging disc is when the disc begins to push out, but the ring is still intact, like a tire losing its shape. A herniated disc happens when part of the inner gel starts to push outwards, tearing through the outer ring layer. A ruptured disc is the most severe form, where the inner material fully escapes into the spinal canal. These terms are often used interchangeably online, but medically they refer to different stages of the same process. Here's the surprising part. The size of the herniation doesn't always match the severity of the symptoms. Even a small disc herniation can press directly onto the spinal nerve, which is incredibly sensitive. That pressure can trigger sharp pain, a burning or electric sensation, numbness, or weakness traveling down the arm or leg. It's not about how big the problem looks on MRI, it's about where it's touching. And that's why two people with very similar scans can have completely different symptoms. One of the biggest misunderstandings about disc herniation is that surgery is the default solution. It isn't. In fact, most disc herniations improve without surgery. That's why doctors don't judge this based on pain alone. They check multiple other medical criteria. Surgery is usually considered where one or more of the following is present. Symptoms are persistent and severe, typically lasting weeks to months. Pain or nerve symptoms do not improve after conservative treatment. And there is objective evidence of nerve damage, not just discomfort. The goal isn't to rush into surgery, it's to prevent harm while also avoiding extra operations. Pain can be unbearable, but weakness is more concerning. If a patient starts losing strength in their arm, finds it difficult to move their leg, grip objects, or walk normally, that means the nerve is actively being damaged. Progressive weakness is one of the strongest reasons why doctors recommend intervention. Another red flag is the loss of bladder or bowel control. This is rare but critical. Sudden difficulty controlling bladder or bowel function can indicate a severe nerve compression, a medical emergency that is in need of urgent surgery. In these cases, waiting is far more dangerous than acting. The third red flag is failed conservative treatment. Before surgery is even considered, most patients go through some non-surgical methods of care. For example, physical therapy, activity modifications, anti-inflammatory medicine, and in some cases, targeted injections. If these methods are done properly and symptoms still don't improve, surgery becomes the next reasonable and effective step. Surgery is not the first step. Disc herniation surgery isn't about impatience, it's about timing. Too early, surgery may become unnecessary. Too late, and nerve damage may become permanent. The decision is made when the risks of waiting are greater than the risks of surgery. Here's what actually happens during disc herniation surgery. For many people, the scariest part about disc herniation surgery isn't recovery, it's not knowing what happens in the operation room. So let's go through it step by step. On the day of the surgery, the patient is given general anesthesia. This means you don't see the surgery, you don't feel any pain, and you don't remember what happened in the procedure. Once anesthesia takes effect, the surgical team positions the patient to protect their nerves and spine for the surgery. Most disc herniation surgeries, especially microdiscectomies, follow the same basic steps. Firstly, an incision is made in the skin. Muscles are then gently pushed to the side, not cut. The surgeon then reaches the affected disc using magnification. Only the portion of the disc affecting the nerves is removed. The goal is very specific, to free the nerve and leave everything else intact. Now I'm going to talk about what's preserved and what's removed. This is very important. Surgeons do not remove the entire disc. They do not remove parts of the bone until it is absolutely necessary. And they also don't open the spine. Only the herniated or loose disc fragments that were compressing the nerve are taken out. Others remain in place. That's why many patients feel relief almost immediately after the surgery. But how long does it take? This surgery normally takes somewhere between 30 to 90 minutes. This depends on the location of the disc, the surgical technique used, and whether one or more levels were involved. For many patients, this is shorter than what they expected. For many patients, the most surprising part about disc herniation surgery is how different recovery felt from what they imagined. It's normal to have surgical soreness at the injection site. Muscle stiffness and tightness are to be expected and are normal. What often surprises patients is that nerve pain is usually much better right away, sometimes immediately and sometimes gradually over the course of the next few days. However, numbness can take longer to improve, tingling can come and go, and weakness recovers more slowly than pain. Walking starts very early. Most patients can stand within a few hours, take short walks the same day, and are generally encouraged to walk gently and often. This early movement reduces stiffness, increases circulation, and generally reduces the chance of further complications. Bed rest is not a part of the recovery phase if minimally invasive methods are used. To learn more about this topic, you can watch our other video. Many patients worry, what if I move wrong and damage something? What if the disc slips out again immediately? Shouldn't I stay completely still? In reality, the spine is stable after surgery and gentle movement is safe and encouraged. The goal for the first 24 to 72 hours isn't to push limits. This is controlled motion. Here's what affects the recovery speed. Two patients can have the exact same diagnosis and the exact same surgery, but they will recover at different speeds. This is because recovery doesn't rely on just one factor, but multiple. Less invasive procedures generally mean less muscle disruptions, smaller incisions, and a faster return to normal life. Microdiscectomies and endoscopic surgeries usually have faster recovery times, even though their long-term outcomes are the same as the more extensive procedures. Where the disc is located matters. Lumbar herniations affect the legs and lower back, while cervical herniations affect the arms, hands, and neck. Cervical surgeries often allow for faster mobility, while lumbar recoveries take longer. This is because the lower spine often carries more weight and stress. How long the nerves were compressed before the surgery is one of the most important yet least talked about factors. Nerves recover slowly. If a nerve has been compressed for months or years, pain relief will be much faster, but numbness or weakness can stay for a very long time and it may not even fully resolve. Lifestyle factors such as smoking, weight, and activity levels matter more than people think. Smoking can cause a slower healing process and reduce blood flow. Extra weight can put a lot of stress on the spine. Posture matters more after surgery than before. Improper sleeping conditions, slouching, and bad lifting positions can put damage and pressure on the discs and slow progress. Small posture habits repeated daily can either quietly set progress back or help protect the spine. Overconfidence after pain relief is one of the most common mistakes. When pain disappears, it's tempting to continue lifting heavy objects, continue intense exercise, and forget recovery guidelines. But early pain relief comes from nerve decompression, not tissues healing. Even after the pain is gone, tissues continue reforming. Some symptoms are part of normal early recovering. Others require immediate medical attention. Contact a doctor immediately if there's new weakness, signs of infection, loss of bladder or bowel control, and new escalating pain that does not respond to medication. If you or someone you know is facing disc herniation surgery, knowledge is your weapon. Understand the procedure, follow recovery guidelines, and do not ignore red flag symptoms. As mentioned earlier, we've made a video on minimally invasive spinal surgery in the past. You can watch it here.